My name is Chet Donnelly. I'm a spine surgeon here in my hometown of Dallas, Texas. And one of the most common questions I get asked is, when can I drive after my surgery? In this video, I'm going to talk about cervical surgery, which is the neck. Let's just get right to it. So the short answer, first of all, is of course ask your surgeon. You know, this varies. They might have a different protocol, but in general, the short answer is you probably can drive 2 to 6 weeks after your surgery. But this depends more on just a calendar date, and that's really what I want to go over. There's different types of surgeries on the neck. There's ACDF in terms of your fusions, and there's PCDFs. Yes, there's other surgeries such as cervical disc replacement or frameotomies. I cover those in another video. Okay, but let's first kind of go over these two different surgeries so you even know which one we're talking about here. So an ACDF is A for anterior. That's where you go through the front of the neck. And in general, patients bounce back from that really fast. They do really well from that surgery. When you go through the front of the neck, 1, 2, 3 levels even. The other type of surgery is a PCDF. P for posterior. Posterior meaning the back of the neck. This is the one where we use rods and screws. They're not as big as the lumbar spine, but it's definitely one that has a bigger incision. You know, I usually say it's about this size at least, maybe the size of a dollar bill. And you can just imagine that's more muscle pain, more post-operative narcotics, and that's the big theme I'm going to keep coming back to here is narcotics and post-op pain. So look, not every cervical fusion is the same. That's the thing I'm stressing. It depends if yours is an anterior ACDF or a PCDF. The anterior ones, patients bounce back really fast, maybe go back to work the next couple weeks. I'll do that in another video. Versus PCDF, much bigger incision, much bigger deal. Okay, so why does this actually matter? Look, the thing that I think matters, are you actually ready to drive and who makes the call? In my opinion, patients need to be off of opioid medication. They should be able to sit comfortably. They should be able to turn and get in and out of their car safely. They also need to be able to brake hard in case of emergency. You'll see in this video here, I have no idea if this patient has ever even seen a spine surgeon, but it's an entertaining video none the least of how, you know, maybe it's not you hit somebody, but even so you're not making smart decisions on the highway could lead to loss of life, multiple injuries. It's a big deal that just even your brain's working well when you're driving heavy machinery, as they say. The other thing, obviously, is making good decisions, but it's just your braking time. For anyone who's been on narcotics or muscle relaxers, what you would know is you have just a delayed reaction to things. So having a faster response, pain, slower reaction, that's important things. Your brake time is a big deal. If there's something bad, you need to be able to stop. So let's talk about it. A C-collar is a pretty common thing that a doctor is going to put you in after your neck surgery. Now this varies by region, varies by level, varies by the surgery they did. Some doctors don't use a brace on a 1 level, some do it on 2 levels and 3 levels. In terms of going to the front, I would say the overwhelming majority will do it for posterior fusions on the back part. I'm in Texas, my hometown, big state. Texas, as far as I know, maybe someone might correct me, but as far as I know, does not have any specific laws that prohibit you from driving while wearing a C-collar. But the real issue, of course, is safety. You want to be able to look around, you want to be able to check your blind spots, moving around. There's also other things to think about, maybe your insurance carrier or just the other liability of having a C-collar. So there's things to think about. So I would check with your local laws, check with your insurance carrier for something that you really want to know all the ins and outs. Okay, let's talk about some less exciting things here. Is there any research on it? You know, someone who, I'm very in the research world, I've had tons and tons of publications. By the time you see this, it's at least 80, but we'll go from there. So in terms of research on it, the ACDF, we actually have some decent data. It's pretty interesting. So look, there's a 2023 study. They looked at 70 ACDF patients, and they found that in those patients, the median time, average time, return to driving was about 16 days, which is about 2 weeks. And these are patients that stopped opioids, and the stopping opioid was about 7 days. So about 7 days, they stopped the opioids, and stopping driving was about 16 days. And those are two things I think is important, stopping the opioids and going from there. There's also a study where they looked at brake time. Obviously, you probably have no idea what your brake time is in terms of milliseconds, but they looked at it pre-op, before discharge, which obviously went down just based on what you're at, and then after surgery, you're 4 to 6 weeks out. Interesting thing from this study, this is an older study from 2000, I think it was 13, but your brake time improved after surgery, which kind of makes sense, right? Like you fix a lot of the spinal cord compression, the pain you're having, maybe you're on pain meds even before surgery, you're doing a lot better now. The PCDFs, back in the neck, there's actually not a great body of literature there. And it's interesting, there's actually been different studies where they've, these different societies we go to, they ask all the surgeons, hey, when do you let your patient? There's so much variability. So me personally, I'm kind of looking at that as maybe that's a source of research I could add to the body of literature, and I look forward to it. If any spine surgeons see this and want to partner up with me on it, that'd be great to get more patients in this. All right, so what's the biggest stop sign? What's the biggest thing that we need to be thinking about? Are you taking opioids or not? If you're taking opioids, I don't think you should be driving. Opioids obviously affect judgment, attention, reaction time, and alertness. Now look, there's certain types of procedures where we really decrease the opioid use, and that's a big deal. And trying to do the ACDFs, much less opioids and PCDFs, again, not the reason you should pick one surgery or the other, but different things to think about. So what's my rule? Again, are you off opioids? Is your pain controlled? Can you sit comfortably? Can you check your surroundings safely? Can you slam on the brakes? If you can't do those things, I don't want you driving yet. The other thing I think is a big deal is just going into that surgery with a full ammunition and ready to go. Just like if you're training for a marathon or CrossFit or sporting event back when we were in high school, maybe some of us college, you want to get nutrition ahead of time. So a little plug here, I think maximizing your preoperative nutrition. If you scan this QR code, it takes you to a website where you can get nutrition before and after surgery. I ask my patients to if they want to for every surgery we do. If they want it, great. If not, no worries. But I just think kind of getting your body strong, something like this that's doctor created, doctor founded, something I really support. Also, shameless plug here. Again, if you're watching this and you're interested, you're like, man, this guy kind of knows what he's talking about, then would love to kind of look at your case if it's something that you're interested in. I have a million other videos on this topic in terms of how to get in touch with me. If you scan this QR code, it will take you to a third-party website in terms of how to upload those imaging. But essentially, you can reach out, snail mail, send your imaging. I do a billion telemedicine visits every week. It's just a big part of my practice from doing items like this. All right, so my closing thoughts. Look, the key thing I want to tell you guys about is there's many different types of fusions out there. How many levels in the neck? Are they using a plate? Are they using standalone? And in the back, are they doing it front and back? In the back, are they doing facet fusion? Are they doing big open? Are they doing MIS? There's so many different types of fusions out there. So just because your neighbor had it one way doesn't mean that's your experience. The other way is check your local laws. Look, I kind of gave you what I think is the law in Texas, but obviously I'm not a lawyer, can't give any legal advice. But check your local laws. See if you're allowed to drive with a brace. See what your laws are. And then check with your insurance carrier. I don't even know how you go about that, but I would check with them to see what they would recommend. The other thing is, consider relying on delivery services, the Ubers out there, the Waymos if you sadly have that in your neighborhood, the Tesla taxis if you sadly have that in your neighborhood, maybe get you places, to bring you food, to kind of get you around. Those are the key things. So look, are you ready to drive? You need to go through that checklist yourself. You need to ask yourself, it's truly a you decision if you're ready to drive. If you are, I look forward to maybe seeing you on the road. Give me a thumbs up. Hopefully not having any issues going on, but it'd be great. And I think this is a nice, good PowerPoint to help people really understand when they can drive after having a cervical fusion.